Millions of people suffering from chronic sinus pain visit their doctors each year. In this week's Martha Jefferson Healthwise report, we take a look at a surgical option available when normal medical management is no longer doing the trick.
As many as 30 million doctor visits a year occur for sinus trouble.
Dr. Paige Powers is an otolaryngologist in Charlottesville, and she treats many people who are suffering from a chronic sinus issue called sinusitis.
Sinusitis is inflammation of the lining of the cavities of the sinuses. It's often caused by both allergic triggers, such as overreactivity to the world around you, as well as to infectious triggers like bacteria, viruses, the common cold that leads to inflammation of those lining cavities.
Sinusitis is most commonly seen in late winter and can affect all age ranges.
That looks great.
Initial treatment for the infection is always medical management with prescriptions and over-the-counter medications, but sometimes it becomes apparent that surgery might be a better option, and that is when Powers suggests the possibility of balloon sinus dilation.
The procedure is intended to open and dilate the sinuses to allow for better aeration and drainage pattern of the sinuses.
Powers says balloon sinus dilation is not new technology, it is a new tool within an old surgery.
So while sometimes patients are a little concerned about trying something that may be new or different, I want to emphasize the idea that sinus surgery has been around for a long time. We're doing the same thing, we're using a different tool that makes it a little less invasive, a little less likely to cause side effects or pain in the post-procedure setting.
The procedure uses a catheter and positions a balloon into the sinuses. The balloon pressurizes to open up the blocked sinuses and then depressurizes and is removed. The minimally invasive surgery is done in office, and Powers says within a few minutes, her patients are able to stand up, walk out, and in most cases return to work the next day.
A lot of patients say it's like night and day. You'll have people who've been having 3, 4, 5 sinus infections year after year who after the procedure say not only are their symptoms gone, but they no longer are having to have recurrent use of antibiotics. If they've had the balloon sinus dilation in the office and for any reason they need additional surgery, it hasn't burned any bridges. It hasn't decreased the possibility of them still having traditional sinus surgery.
Dr. Powers says there is up to a 45% decrease in cost to the healthcare system for an in-office balloon sinus dilation as compared to traditional endoscopic sinus surgery. And for more information on balloon sinus dilation, you can visit newsplex.com after the newscast.